Hello, I'm Gunjan Verma. I'm the managing partner for Asia Actual in India. We have an office in Gurgaon in Haryana in the northern part of India. And we have a team of 8 people at the moment, which is looking after regulatory affairs. And likewise, we have a team which is dedicated to logistics and operations as well. I have been associated with the pharmaceuticals and medtech industry for over 25 years now, and has been an exhilarating experience, and the learnings at Asia Actual, working with innovative clients, multiple products, has been quite a journey for the last 10 years for Asia Actual. An ideal client for me would be someone who is challenging yet cooperative. So the challenge would be that the client has a very interesting device where the regulatory pathway is not simple but still doable, and gives the team, that rush while we are doing the project. They should also be very responsive to our needs. Like if we are asking them for a certain type of document, documents should come in quickly, cannot take much long, otherwise the enthusiasm kind of fizzles out. So the ideal client would be somebody who has that enthusiasm, has a project which is challenging, and also is in a rush to get it all through. So that would be my ideal client. So the Indian regulatory system relies heavily on 2 pillars. One is reference country approval, wherein there are certain identified reference countries like the United States of America, United Kingdom, any of the European nation countries, Australia, Japan or Canada, or wherein the regulators require that the reference country free sales certificate be provided to them for review. Now that's one pillar. If that part is sorted, the second pillar is predicate devices. If we can have an established predicate already approved by CDSCO in India, then together with reference country approval, the pathway in India is fairly, I wouldn't say simple, fairly clear, and can be navigated with ease. India is a large market for imported medical devices, so a reasonably large chunk of medical devices across all categories and across all risk classes are already registered in India. So we do have the luxury of being able to find good predicates. However, in cases where predicates are not available, or even if predicates are available, they aren't considered to be good matches by the CDSCO. In those cases, such products are referred for expert committee reviews, which kind of takes the project trajectory on a different route and delays the timelines, and also the burden of a local clinical investigation in the worst case, or local post-market surveillance in the best case are the outcomes of such situations. Previously in India, software as a medical device were not regulated and could be freely imported or downloaded by the healthcare practitioners or by healthcare establishments. Recent changes in the regulation, wherein we have a new definition of a medical device and a transition to a fully regulated regime in India, requires that all medical devices, including those which are enabled by artificial intelligence or machine learning, or either are standalone software medical devices, would require registration in India. Having said that, the not so great part is that the regulators in India have not released any special checklists for such devices. The checklists that are there on the portal are the same which would be for any physical medical device. The same would apply for a software as well. Now that is a challenge. In the past, there was less understanding from the regulators' part on such devices, but like we are learning, regulators are learning too. And recently we see that the queries and the questions that we are getting from the regulators show an understanding of the product, and we are not getting any frivolous queries any longer, and queries are, you know, specific to software verification, soft validation, and nuances which are applicable to the innovative software devices. So that's a very heartening development in India, and we look forward to more, including a specific checklist for such devices coming forward.